good luck, everyone. I'm sure it will be a wonderful event.
Thanks, Dom. Thanks for all of this. Hey?
No problem.
Hi everyone, I'm just going to give it like another 2 minutes max and then we'll begin. Thank you. Okay, afternoon everyone, and on behalf of the Vet Students Bioethics Society, I would like to thank everyone for joining our very informative webinar on mental health challenges which students face in the Faculty of Health Sciences. I'm Simran and I'm the current Vice Chair of the Bioethics Society. It is common knowledge that the curriculum across the Health Sciences faculty is overloaded with a tremendous amount of information, crippled with inordinate hours, sleep deprivation, excessive workload, overbearing clerical and administrative responsibilities, inadequate support from the other health professionals, a large number of difficult patients, and conditions for learning that are less than optimal. The COVID-19 pandemic has been followed by a sharp spike in suicides, which was exacerbated by social isolation due to the quarantines and social distancing guidelines, fear, unemployment, and other financial factors. This and the added era of online education certainly has the potential to further deteriorate mental health outcomes with elevated anxiety, stress, and depression. Many students in particular, those of vulnerable groups such as women, children, members of the LGBTQ community, which one of our members, Luke, will touch up on later, were forced to quarantine in unsafe environments as we've seen an increase in reported domestic violence. If any of this speaks to you, I want you to know that you're not alone and mental health is a legitimate medical condition. And remember to seek for help and not feel ashamed when asking for it. This day and this initiative are reminders that regardless of the field you're in, your mental health matters and there is no shame or stigma in struggling. As the WSBS, we feel very strongly for mental health matters and therefore advocate to eradicate the stigma, shame, and negativity on this matter. We stand together as a society and affirm each and everyone who tries to see the light in every day. I will now give it to the Student Surgical Society. Amy?
Hi, everyone. So as mentioned, my name is Amy. I'm the current president of the Student Surgical Society. We're very proud to be co-hosting this event this afternoon, and thank you all for joining us online. It's events like these that I believe truly begin to turn the tide for what is increasingly becoming another pandemic amongst mental health amongst health workers and students. While we battle the pandemic of COVID-19, it's no secret that mental health amongst those on the front line is really struggling. Being a health science student at the best of times is very challenging, but paired with online learning, load shedding, and intermittent isolation from friends and family, it feels near impossible. It's no wonder then that so many students are affected by mental health concerns. Although this conversation is really not a new one, the continuation of it is so important. And as a society, we are so grateful and humbled to be able to participate in such events. At the start of this year, the Surgical Society hosted our annual Burnout and Resilience panel that was actually organized by Previn and hosted with Dr. Lautenberg. We addressed the plague of unhealthy competition amongst the young students and doctors and why there is such a trend to tear each other down instead of working together towards a common goal. As a society, we have committed ourselves to addressing such issues amongst the student body in safe spaces. Tonight, we hope this to be a continuation of similar topics. I hope everyone watching has their thoughts stirred by the amazing Dr. Rabe and can go on to continue this conversation of mental health and why it matters in their own circles. Thank you.
Thanks so much, Amy. Our next speaker is supposed to be Luke, but he's having like technical issues. So I think we should move on to Dr. Shannon.
All right, guys. Well, firstly, I just want to thank all of you for the massive effort that has been made by the societies to help me get the word out about today and for always including me in anything that has to do with mental health, because it is something I'm exceptionally passionate about. And it just makes me so happy that our young doctors, the future of medicine, is willing to have these conversations and to talk about the difficult things. I just want to really express my gratitude to Bioethics Society and to Surgical Society for organizing this, but also to the MSc, the PAT Society, Physician Society, SAMHSA, and WHI, just for all of you really putting out the word and getting us all involved in this. It really has humbled me, and it just makes me so proud that I can say that you guys are my students and that you guys are really going to change the world one day. I firmly believe it. I wish I could give you all the stats and all the information that exists out there on mental health, but I really can't. But I can give you my opinion as my experience as a health science student many years ago and as a doctor working in the South African healthcare service. Our profession focuses on providing care and support to every patient who walks into our lives. And from a very young age, we take an oath to serve and to protect our fellow human being to the best of our abilities. The thing I feel we all forget about is how important we are in this oath. If I do not protect myself or my mental well-being, there is no way that I can possibly protect others. I think we often tend to forget that when we see a patient, we are often becoming part of the worst day of their lives. But for us, it's just one of many paths that we cross in just one single day. We are only human, and it is our humanity that makes us kind, compassionate, caring healthcare providers. But that means acknowledging that sometimes we ourselves are not okay. Being strong doesn't mean suffering in silence or denying our humanity. It means accepting that sometimes we need help, we need support, and we too need to be cared for. Our emotions, our pain, our experiences, our fears, they're all valid and they deserve our time and our attention. When we learn how to provide basic life support, we learn how to identify hazards first, because putting our lives in danger, even for a patient who needs care, just doesn't make sense. But what I find so strange to believe is that we are willing to put our mental health in danger out of fear of being perceived as weak or undeserving of our position in our profession. Our humanity is what makes us special and unique and empathetic healthcare providers. And in accepting that sometimes we are struggling, we help all of those around us who battle the same struggles. Part of traversing this journey that we have chosen, this career, this profession, is understanding that our friends and colleagues may also be suffering in silence out of the same fear or shame. And it is our responsibility to show kindness and care to not only our patients, but to our peers and our colleagues. It's up to us and you, our junior doctors, our future doctors of this country, to change the way that the medical profession and the world sees mental health and illness. There need be no stigma anymore, only support. There need be no shame, only understanding, and there need be no fear, only encouragement. Mental health can affect anybody. That person who always smiles at you in the corridors may be easily fighting their own battles, but feeling so alone and vulnerable and scared. So every time we do something like this and we talk about mental health and we prioritize our mental well-being and we open up non-judgmental conversations about mental illness, we help those who are suffering in silence to feel heard and to feel seen. And we can help to shrink that stigma so that one day nobody has to feel alone anymore. And I really do believe I've been involved in so many panels and webinars this year where we've spoken about mental health, and it just makes me very happy, because the more conversations that happen like this, the more we are breaking that stigma and people feel like they can talk about this and they can be heard. And that is the most beautiful thing about all of this. But that being said, I would like to introduce Prof. Lizette Rabe, who has joined us from the Itemba Foundation and from the Stellenbosch University. As you guys have been able to see, it's been posted a lot. Prof. Rabe has an incredible bio, a list of amazing achievements and a star-studded career path that I could only dream of achieving one day. And I'm not going to go through all of the incredible things that she's done. I'd like to focus on the thing that actually brought Prof. Rabe and I together, which was the Crazy Socks for Docs campaign that she first contacted me about in 2019. Today is very special because it's actually the first time I've gotten to speak to Prof. Rabe in person, because we've communicated for the last 3 years, and through her guidance, through the Itemba Foundation, which she founded, we have tried to spread the word through VITS, and from the Itemba Foundation side, the word has been spread through all health science campuses throughout the country. And it's just so wonderful because we have a shared passion for mental health and for our students, and for hoping that you guys are going to be the people that change the way mental health is viewed, and you guys are going to start these conversations and hopefully continue them for the rest of your lives. So it is my pleasure and my privilege to introduce Prof. Rabe to join us. Thank you so much for making time available to be here with us and to chat to us.
Thank you, Dr. Lautenberg. I think what I want to say is just going to be superfluous to what you and Amy and Shimran have said so far, because I'm just going to repeat what you have just said. So from my side, good afternoon from the Cape of always good hope, because that is what we should hang on to. And I just want to say thank you to Previn and the WITS student societies on the health sciences campus, but Previn specifically from the Bioethics Society for honoring me to invite me to your very own family night, especially on Crazy Socks for Docs Day, a day on which, as Shannon has just said, a day on which we need to raise awareness of the pressures under which our healthcare workers work, and which, of course, also affect, in a very dire way, you as medical students. So by wearing these bright, mismatched, funky socks today, we start the conversation about the mental health of healthcare workers and start to break that stigma and that silence. And we've been talking about this for years, and there's still a stigma and still a silence. So, you know, initially when Previn said, the webinars on Friday late afternoon, I thought, who's going to attend this? But Previn said, don't worry, pre-COVID, this was the family night together, all together at the end of a difficult week. Now with COVID, it is together online, and relaxing. You can, there's no class, no tests tomorrow. So I want to stress, you can relax, because this will not be an academic webinar. And I hope it's just not going to be a talking head either. And I need to state that you know much more about mental health than I do, because I'm an autodidact. So what I know, I've learned myself with regards to mental health. I've read many books, read so many research projects on the subject, also prescribed texts in psychiatry. But what I really know comes from firsthand experience. And that is why medical students will always be so special to me, because my husband and I, we've lost one of our sons to depression when he was a fourth-year medical student. And depression was described by the author Virginia Woolf as this terrible disease. She wrote that in her last letter to her husband before walking into the River Ouse. So if anything, I know how devastating and destructive mental ill health can be, and especially how medical students cannot talk about it because they fear discrimination. But that is exactly why I have become a mental health activist and an advocate, and why we need awareness raising of the importance of mental health, because without mental health, there is no health. That is the foundation for all health. But we don't only need awareness raising, we also need action, like all of you did by bringing awareness and action together today, I hope with some fun and funky socks on this Crazy Socks for Docs Day. Thank you, Shannon, for all you did on the WITS campus. So in South Africa, this day was an initiative started by the Itemba Foundation. And the Itemba Foundation obviously is a non-profit entity aimed at raising awareness of depression, but not only depression, also related illnesses. As we now know, they are biological illnesses. They can be treated. And then also the other public benefit goal of Itemba is to raise funds for research into mental health. And Itemba means hope. And if depression and related illnesses are the illnesses of despair, we need to hang on to hope. So that's why it's a greeting from the Cape of always good hope. So as a foundation for our family night discussion, I want to stress that when Previn, as chair of the Bioethics Society, invited me, I immediately felt that, yes, okay, this would be the starting point for our discussion, because it all starts with ethics. And I must say, my dear ethics professor, one of the mentors in my life, to whom I will be eternally grateful, will be so proud of me making this statement. But it is really my deep belief that we have an ethical obligation to break the silence and the stigma around mental health and see them as the clinical biological diseases they are. Diseases that should be humanized and normalized, but we still prefer to hide them from others. So why is this still the case in our so-called modern 21st century society? And why is it then our task? And you've also referred to the results, the fallout of COVID, that mental ill health has grown into a so-called silent pandemic. So it has become a task for us to try and do something about this silent pandemic that is affecting humankind globally and which will have a lasting effect for many, many years to come. First, back to the subject of ethics. I majored in philosophy, and of course, the father of modern Western medicine is, as you know, Hippocrates, the ancient Greek physician whose approach to medicine is still honored today by the Hippocratic oath you guys take on graduation as indication of your commitment to the ethical treatment of your patients. In the time of Hippocrates, philosophy and the natural sciences or the medical sciences were actually all rolled into one. And that is why specifically bioethics is a branch of applied ethics that studies medicine and life sciences from philosophical, social, and legal perspectives. And that is, of course, the link between philosophy and the medical or health sciences. So from my point of view, that includes we, and it includes all of us, you as medical students, the healthcare environment, also us as the public, that we have an ethical obligation to help those who cannot help themselves when our most important organ, our brain, is malfunctioning because of a lack of neurotransmitters caused by whatever reason, whether biological, hereditary, societal. And if ignored, we know too well, it can develop into an illness that can become life-threatening. So that would be my simple message to you today. Let us do the ethical thing and care for others. But my message actually begins with the fact that you first need to care for yourselves. That is the basis, the starting point of care. It certainly is not selfish. Put simply, to be able to care for others, you need to care for yourself first. If you don't do that, you will not be able to care for others. It's actually as simple as that. It's like the air hostess's message in the plane before liftoff. If something happens, first put on your oxygen mask before trying to help others. Without that, you will not be able to do so. So please put up your own oxygen masks by first looking after yourselves. As health sciences students, you know what the symptoms of mental ill health are. You should not only be able to recognize them in your mates, but also in yourself, and then act. Don't hide from them. As you know, a disease won't go away when you ignore it. It will in fact only grow bigger and bigger and can even develop into a fatal stage. We know from studies, and you know that better than I do, that suicide is called an occupational hazard for physicians. That dreaded S word, that some researchers now prefer to say it is the fatal outcome of depression reaching a terminal stage. Suicide is the only cause of mortality that is higher in physicians than non-physicians. And we also know from studies that increased suicidal ideation begins in medical schools. Percentage-wise, it is much bigger among med students than other groups. In one analysis, it was found that more than 24% of medical students reported suicidal ideation within the past year. A specific South African study estimated that around a third of South African medical students have suicidal thoughts, and that over 6% of medical students attempt suicide. A Cape Town study found that 30% of public primary healthcare doctors are living with moderate to severe depression. And then you hear, but you've got to be tough. You've got to be resilient. So what does it mean? I certainly am not tough and not resilient, but I've read almost every good book out there on being resilient by major researchers. And I still know it's far easier said than done. So where to seek help? And of course, the irony is that you are in the caring professions, yet you might not know how to seek care for yourself. You know that a medical campus, and the first speakers also referred to it, can sometimes at best be a merciless environment. But that is exactly why you should seek help when you recognize those symptoms you studied in your psychiatry modules. So where and how to seek help? First off, you should get professional help and ensure you have that help close by when you need it. So you make sure where on campus you can access that professional help. A professor in psychiatry recently said that burnout is such a reality in the medical professions that he described it as a burning ship coming closer and closer. He's also adamant that the healthcare system needs to acknowledge that healthcare workers are in a total situation of burnout, or in his words, dysphoria, with what he calls moral distress, I'm sure also a term that you know, a daily reality. He urges healthcare environments all over, national, provincial, to put mechanisms in place to address this. And he said it should not only be a plaster, like, as he put it, 1 or 2 sessions of baby goat yoga. And I quote him, it should be continuous attention to the mental health of employees. So you might have heard that term moral distress, especially as a result of COVID-19 treatment, where you've got to decide who to treat, who to turn away. So this moral distress is taking an immense toll on healthcare workers. You know that being a student in the healthcare sciences also leads to such stresses that you might feel burnt out, leading to depression or one of the anxiety disorders. Also that you are entering a profession and a system where more or less everyone suffers to a bigger or lesser extent from it. And then people come and say, oh yes, but healthcare workers should get resilience training. The fact is, one can be as resilient as possible. But if you have to operate in a broken system, your resilience will just evaporate. Because as you might have heard from other junior doctors, there's no time to eat, nor to sleep, even to go to the loo. You have to be awake for 30 plus hours. Then also resilience training will not give you that extra Superman strength. We know this broken system must be repaired, and we need to start with each of us. But while we're participating in an awareness campaign, we should remember that awareness and advocacy mean nothing if that third A, action, is not added to it. So I hope you've all done it today by adding that third A to awareness and advocacy, simply by some action of wearing your funky socks. But it won't make the stigma and the silence just go away. I'm sure the following could have been any one of you. This is a letter by an anonymous medical student in the USA, which was printed in a medical journal a couple of years ago. She wrote, I write this because I'm a 4th year medical student, typing on a small laptop in my closet in the dark. Because I'm sitting on the floor with my back against the wall. Because to my left lies a pile of unsorted clothes and underneath a silver knife. Because in my senior year of college, I sat on the corner of my bed, on my bed, because back then my closet was overfull of skeletons and nightmares seeped in under door cracks and through the walls, and there was nowhere left to hide from my darkness anymore. And that blade seemed like it would be kinder than the psychologist who diagnosed me with depression. and laughed when I told her I was too afraid to check my email. I write this because I cannot ask for help. Because first I was a pre-med student and now a medical student. And soon I will be applying for a residency program. And then I hopefully will become a practicing physician. This is why I cannot ask for help. So you also know that catch-22 situation. It also applies to many of you. But my plea to you is, please ask for help. It is a sign of strength, not of weakness. We know how you face unique barriers to self-care. It is stigma, it is a lack of time, it might be a lack of access to care, it is fear of discrimination, indeed fear of being regarded as a weakling, because you're supposed to be the carer, not to be cared for. But as I said, to be able to care for others, you need to first care for yourself. Learn the importance of self-care right here, today, on this Crazy Socks for Docs Day 2021. Healthcare workers are not supermen and superwomen. The cardiologist who started the Crazy Socks for Docs campaign in 2017 in Australia, which the Itemba Foundation then picked up and brought to South Africa in 2018, very low-key. And then the next year I contacted, for instance, Dr. Lautenberg for a bigger campaign. But that cardiologist in Australia, Dr. Jeff Toogood, and doesn't he have a wonderful surname to be too good? Dr. Jeff Toogood suffered from all these burdens. Instead of doctors understanding more about mental health, you would hear flippant remarks from colleagues. I'm sure you've heard the one about not knowing a sane psychiatrist. So, would a cardiologist suffering from severe depression and anxiety then come out? Of course not. As he himself wrote, my initial help seeking was delayed because I feared deeply the potential repercussions for my career if words slipped out about my mental health issues. He also mentioned his feelings of shame. As a doctor, he said, he felt he needed to be bulletproof, especially in the case of mental health. And indeed, comments reinforced his feelings of being a failure. They were from that he was not able to cope, or perhaps had even chosen the wrong career, or the one of not being resilient enough, or that it was his choice to feel that way. As if a cancer patient would choose to have cancer and feel like having cancer. Or some just said, you know, we all feel sad sometimes. So that Crazy Socks for Docs was born directly out of the behind the scenes comments from colleagues about his mental health. Dr. Toogood felt the medical fraternity should set the medical standard and the community standard, especially around mental illness. As he wrote, we are also responsible for change. Think about your own comments, actions, and behavior, because the stigma stops with each of us. It's the stigma within us and around us that is lethal. And he used that word because he was on the edge of suicide. So bring awareness raising and action together with how you plan your career path ahead, caring for others by caring for yourselves. I've sent Previn 2 links to 2 short but informative YouTube videos on depression, coincidentally also created in Australia. And I've asked him to forward it to you or post it on your social media sites. They are videos commissioned by the World Health Organization using that metaphor, well known, of depression as a black dog. The British statesman Winston Churchill suffered from depression and referred to it as his black dog. But that metaphor has been used as a metaphor for depression from classical mythology to medieval folklore. So my message to you is, even though the black dog might accompany you for the rest of your life, it must obey you, not the other way around. It must listen to you. Never allow that black dog to dictate to you. And to end on a lighter note, if you've not yet posted your sock selfie on Itemba's social media, do so. It's not only part of breaking the silence and stigma, of changing awareness into action, but you can win yourself, of course, a cool 1,000 rands if you have the most likes for your sock selfie on your campus. And then lastly, this is a special month. June is also Youth Month. And you, as the next generation of leaders in our country, can already start making a difference. We also know June is the month of pride for the LGBT community. So add all these factors together and make it a month that will be the foundation for a future of making a difference. Take this simple mantra with you on this year's Awareness Raising Day of the mental health needs of healthcare workers. Very simple. Seek help, be helped, and always hold on to hope. Thank you.
Thank you, Dr. Lautenberg and Prof. Rabe, for your very wise and informative words. We're all so fortunate to be in your presence at this event tonight and to share in your wisdom and knowledge with you. So thank you once again.
My pleasure.
So thank you. So my name is Luke. I'm a fourth year medical student and the treasurer for the Wits Students Bioethics Society. I'm privileged to be able to speak very briefly on a topic that is quite important to me and many others at Wits and beyond, and that is the overlap between mental health and the LGBTQ+ community. Now, as Prof. Rabe said, June is Pride Month, and I think that there's no better time to address this topic. So imagine growing up knowing you are different, knowing that no matter what you do or say, you are forced to grow up in an environment where your so-called difference is frowned upon by school peers and society, an environment where social and cultural institutions deem your difference unacceptable, and an environment where you so desperately want to be yourself and be with others like you, but you feel trapped and unable to do so. This is the case for many LGBTQ+ individuals, and the discrimination and prejudice experience can have everlasting effects on mental health. So in South Africa, 39% of people identifying as LGBTQ+ have been verbally assaulted. 29% have been threatened with physical violence, 18% have reported sexual assault, and 7% report having been punched, kicked, or beaten up purely for existing. These statistics are frightening to say the least, and anyone would understand why mental health-related issues are so rife among these identifying as LGBTQ+. So you might be wondering what some of the statistics are. A 2016 study by the CDC stated that lesbian, gay, and bisexual youth are 3 times as likely to consider suicide compared to heterosexual individuals. Another study by the Trevor Project, the 2019 National Survey on LGBTQ youth mental health, found that 39% of LGBTQ+ youth seriously considered suicide in the year prior to the study, with further findings that 71% of LGBTQ+ youth feel sad or hopeless. So depression and anxiety are also far more prevalent among LGBTQ+ individuals compared to heterosexual individuals. Lesbian, gay, and bisexual youth are 1.7 times more likely to experience symptoms of anxiety and depression, and this increases to 2.4 times more likely for those identifying as transgender and non-binary. This is quite a scary statistic, and one can only imagine how overwhelming it must be dealing with these stresses. Not to mention that those in mental health, those in health sciences must, be experiencing these on a crazy level. So most of these statistics that I've read above are based on youth. So why are the same trends seen in LGBTQ+ adults? And this often boils down to adults having to deal with a society that often rejects or stigmatizes them. And discrimination often continues well into life and throughout life. So what can we actually do to help these individuals who are part of the LGBTQ+ LGBTQ+ community? So if you find yourself struggling with mental health, please don't hesitate to reach out. So in terms of resources available, the Trevor Project provides services for crisis intervention and suicide prevention for LGBTQ+ individuals under the age of 25. Pride Institute is another organization which provides a 24/7 mental health referral hotline for the community. Now, more local resources include the South African Depression and Anxiety Group and also university resources. And it's very important that we make use of these resources that are given to us. So as a VIT student in health sciences, OSS is a great resource to access psychologists and counselors, and CCDU provides the same resources for students from other faculties. The VIT Student Crisis Line is another electronic resource available. And one thing that's also very, very important is please speak to friends, speak to family, and speak to university staff if possible. But don't forget that you are never alone in this battle. Please also check on your friends and peers and check on your family members. If there's one thing everyone has become good at nowadays, it's hiding our emotions behind a smile. So it is our role as health science students and students in general, as future doctors, lawyers, and teachers, to dismantle the toxic views on the LGBTQ+ community, because the lives of many of the future may depend on it. So the real question is, how are you going to make a difference? Thank you. So I think now we're going on to read some of the questions that have been asked in the chat, as well as some that have been sent to us prior to the event. Vari, over to you. Thank you.
Thanks, Luke. Good evening once again to our panelists and to everyone who's in attendance tonight. My name is Vari and I'm a fourth year medical student, and I'm also the secretary of the Bioethics Society. I really think that this is an important conversation to be having, and I'm really privileged to be able to open up the Q&A session, especially during the time of exams. There's been a lot of attempted suicide, so I think that this is a very important conversation to be having. So I'll be asking some questions that were submitted to us in anticipation for tonight. The first question is, in first year, the content is of a difficulty level that is reasonable, but the sheer volume and rate at which it is given to you is overwhelming. It's like drinking from a fountain of knowledge, and more so like trying to drink from a fire hydrant. How would you advise students to keep up with, understand, and practice, for example, with past papers, this content without letting it completely consume your life?
Vari, is that question to Dr. Lautenberg or to me?
To anyone who would like to answer.
Okay, right. Okay, who goes first?
Well, I can add a comment as having been a healthcare student or health sciences student a rather long time ago. Something that I also struggled with was there was never enough time in a day. No matter how I planned my day, no matter what I did, there was never enough time in the day to learn everything. So I was not a very good student. I did not cum laude any degree. I don't think I got an 80% for anything ever in my life outside of school. But what I learned, or what I tried to teach myself very early, is in no profession, in no career, in no field can you know everything. It's an unrealistic expectation to have to be able to put everything that exists into your brain. So I think you also need to be gentle with yourself to a certain level, that yes, this is important, and yes, I need to learn it, but I can't know everything, and I can't feel guilty or hate myself because I couldn't get through absolutely everything that existed. Because I think it's our own pressures, or perhaps from our family or from our peers or from us at the university, that we ask you questions and you don't know the answers to these things and you feel stupid, but you're not stupid. It's just, I have many more years than you do in this, and I've learned different ways to deal with it. But I think you have to make sure that you understand you can't know everything. There is a certain degree of knowledge that will come with experience. And you have to also be gentle with yourself and understand that taking a break, watching that TV show, walking your dog, sitting with your mom, those things are important. And if you don't prioritize that, you'll never get through your work anyway. I don't know if Prof agrees or has some other words of wisdom to add.
Yeah, thank you, Shannon. I agree. You know, every day only has 24 hours, and you can only do so much in every 24 hours. So in your case, it means attend class, catch up with homework, study for a test, whatever you have to do. And then my advice would be to prioritize and see where you can maybe lag behind a bit just to get yourself going and to keep yourself going, and then make up for that on another day. Because as Shannon said, you don't have to cum laude everything, as long as you understand what's going on. Don't put that pressure on yourself. Just, you know, stay above water. Luke referred to the suicide attempts, etc. We are living in a terrifying time. I think, you know, the silent pandemic wreaks havoc with our psyches much more than the COVID-19 pandemic wreaks havoc with our bodies. So we need to give ourselves space. And I say that also because even if you're fortunate enough not to have caught COVID, the virus, and have stayed healthy, we are all affected by COVID. We all suffer from what is called brain fog, where your memory and everything is affected because it's just, you know, it's just too much. One symptom that no one has yet described in terms of COVID-19 is that in the universe there appeared this big black hole that's sucking up time, and we don't know what happened to 2020. We're already in the 6th month of 2021, and we're still struggling to find our feet for 2020. So be kind to yourself. Don't expect too much. Make sure you know what you need to know, and next week catch up with that you ought to have known for today. So prioritize. Take it step by step. We're not supermen, we're not superwomen. So please be kind to yourself.
If I could just add one quick word in there as well. I completely agree with what Dr. Lawsonberger and Prof. Rabe have said. Another thing as well is, as medical students and as students in general, oftentimes we tend to just have it in us to feel the need to compete with each other. And there's nothing wrong with healthy competition, but also remember that we're not in this alone, and don't forget that there's always people around you. Don't underestimate, you know, the importance of also working together. And I don't mean like, you know, cheat or do work for each other. But I mean, in terms of, you know, if you have a lot of content to study, break it up, you know, with your friends into groups, make notes, share things. You know, you'll notice, especially as you get further along, that it becomes very, very important to have a good group of friends that you can also rely on to help you out when you need.
Thank you for those answers. It's really an important reminder that we only have 24 hours in a day, as much as we feel like we need to be doing everything. So I think that's really valuable advice. Another question is, so far, a lot of people have addressed how to avoid burnout, but I want to know, how would you advise someone who is already burnt out on how to cope with the daily general stresses of being a university student?
Shall I go first, Shannon, you?
Yeah, no, sure, you go.
Go.
All right, cool. No, it's difficult. It's difficult because we speak a lot, especially in this past year, we speak a lot about how to identify burnout and what can we do to prevent burnout. But we don't factor in that a lot of us are burnt out from last year already. The thing that perhaps I can give an opinion on is what I've done to try over my career. My ComServe burnt me out exceptionally. It's why I stopped practicing medicine, was because I stopped I stopped having compassion for my patients. I didn't care that people were there. I was no longer empathetic. I didn't want to help. Everybody being in the hospital was more of an inconvenience to me. And I remember having a conversation with my mother, and she said, something is wrong. This isn't how it should be. You need to change your trajectory. You've got to do something else. Now, I was very lucky that I was in a position where it was the end of my community service. I didn't have to study anymore. I didn't have to spend late nights getting through the work. But something that was incredibly important for me was to go back to why I wanted to be a doctor. What about medicine was special? What made me want to be a doctor? But beyond that, what made me special? What made Shannon excited? What made Shannon happy? And it was all the things that I had stopped doing that I realized I need to put more of this in my life. I understand you guys have an intense workload. It's horrible to work online. I did it last year and I hated every second of it. So I can't tell you to just stop, but you have to remember to do the things that make you happy outside of medicine. And I know that compounds your stress even more, because if I've only got 3 hours to get through what feels like 14 hours worth of work, I can't stop, I can't go out. But you have to prioritize yourself and what makes you happy. You can't let that go. So I started drawing again, and I started running again, and I started baking. My poor husband ate so many cakes and cupcakes, and like the man put on so much weight, eventually I had to stop doing that for a bit. But it was the things that made me happy and brought me joy, and that's what I started doing again. And you guys also need to, like Prof has said, you need to reach out. You need to go to OSS. You need to make appointments with the counselors and the psychologists. You need to consider medication if that's what's going to help you to feel better and to feel like you can overcome the emotions that are pressing you down. And in certain instances, consider taking a leave of absence. Nobody says med school has to be 6 years. Who said that? Why does that have to be the case? If you need a break and you can't, then you must afford yourself the opportunity to prioritize what is important to you outside of medicine. So yeah, Prof, I'm sure you've got something to add.
I can only underline what you've said. You know best in terms of what the symptoms for burnout are. So test them, go through that whole list and see where you are on that continuum of burnout, and say, I've got to take time out, or I've got to prioritize certain things, or I've got to go for a daily jog, because that we know, releases the endomorphins in our brains. So you've got to take control and not become a victim of the system, because that is, I guess, where we all end up, victims of burnout. And I mean, higher education is also, there are so many stresses. And, you'll say, okay, well, the art and social sciences faculty, that's, where you sit and dream under a tree. but there are different stresses. And you've got to run every day. You've got to keep up with, the schedule and everything. But take time out, because if you're burnt out, there's nothing left of the candle to burn anymore. So before that candle burns out, stop, take time out. As Shannon said, there's no prescription to say, a doctor must study for 6 years. Take an extra year. Why not? Or just, come in with a lower mark. Whatever is the solution, but don't push yourself beyond the point of burnout.
Thank you for those answers. A lot of people do feel, though, as much as I can take self-care days and exercise and, do the things that make me feel good, that the university lacks policies around mental health. And why is it treated as taboo and not as any other chronic illness? Many students feel that when they face mental health challenges, their institutions aren't supportive or helpful. What do universities need to do to better support our students?
So I can speak from, I'm sure Prof's going to have a lot to tell us, because she is the head of a department and can give us a lot more of a perspective. But something that I can say is that I do think that the universities need to acknowledge the idea of a personal day, acknowledge the idea that just as I can give a sick note because I had bronchitis, or I didn't come in because I had symptoms of COVID, because I'm protecting everybody. I'm not coming in today because I'm having symptoms of depression that I can't deal with, and I need to be at home for my health. So I think the problem is, like we've been speaking about today, there is still a massive stigma, and there is still this massive belief that put your big girl pants on and go out and do your job. This is what's required of you. Everybody's felt like this before. And it is a cycle that is constantly being broken. And I think with like, for example, at UMI, we're very fortunate. We have a very young department. We have a lot of us who've experienced burnout, a lot of us who are in UMI because we were trying to find a different avenue to pursue our love of medicine that didn't involve having to work in a state hospital, where I was doing 160 hours of overtime a month, where I wasn't getting paid for 80 of those hours, and I still had to be a good wife and a good daughter and a good sister and a good friend, and I just couldn't anymore. So a lot of us know where you guys are coming from, and we are hoping that we are putting out there policies that will change the way that you are experiencing what's happening. But it's a lot of I can't think of a better word, but it's a lot of an old school mentality that still needs to change. And it's with conversations like these and you guys telling us, this isn't working for me, this needs to be better, we need to prioritize this. The curriculum is very content heavy. We can't physically get through this, because that is what's happening now, is that I see Dr. M and all of them are sitting in curriculum meetings, finding ways to change the curriculum. But it's only because of what you guys have told us and what you've brought forward that this has been something where we're like, flip, okay, this needs to change. And I think that that's an amazing place to start from.
Once again, I can just, underline what Shannon has said. There can be as many mental health and well-being policies on a campus, but if they are not executed, and if we don't say to the deans of faculties, we've got to change this, and the change must come from you guys, because we also now need to factor in COVID. It was already heavy and top heavy, and now COVID has made everything come tumbling down. So, we need to look at different practices and different policies, and put policies into practice, and also make it easy to access care and help. On our campus, for instance, students still have to physically walk into the Center for Mental Health Help, whereas for going to the ordinary doctor, they can make an online appointment. So even walking, you've got to walk into that building to make an appointment. It's not online. So that in itself is something that really, gives you a label. Oh, look who's walking in there. So we're working on something where people can also make online appointments seeking mental health support, and not only physical health support. And we need to humanize and normalize mental health. It's not something different to physical health. It's the foundation for physical health. And you should tell us, we cannot anymore, we've got to change things. Go to the deans, tell them what the situation on the ground is.
And you mentioned going to specialists and going to psychologists. Someone put a message in the chat saying they would like to know where other faculties can consult with psychologists that would be willing to meet up with patients and check their progress because they have a friend who's suicidal. So yeah, we know that as med students, we can go to OSS, but the other faculties might not have that access.
Well, if I can speak about OSS and the staff that work there and the staff that I've had experience with, if there is a student anywhere who is not coping, who is struggling, who is dealing with suicidal thoughts, if OSS can't help them, they will find somebody who can. So if you have a friend or somebody in a different faculty, give them the contact details of OSS, give them the medical student crisis line. There are, I will send through to bioethics and to SurgSoc. I have a list of facilities that are around Joburg that are 24-hour helplines, walk-in facilities that will offer admission.
Yeah.
There are an abundance of places to access to if you have the knowledge that they exist. But no one must ever not seek treatment or care or guidance or even just a conversation because they feel as though, for example, OSS is specific to the med school and the students that are there. If they know where the office is, they must walk in and have a chat with someone. There's email addresses, there's phone lines. They must call regardless of what faculty they are in, especially if they are in a place where they are willing to acknowledge that they are not feeling well, they're not coping with all of the overwhelming feelings that they have. There is no one at OSS who would turn them away. That I can say with 100% certainty. And I will send through all of the stuff to bioethics and to SurgSoc. I've got contact details for so many different facilities around Joburg.
You know, and
Thank you.
I also think giving those numbers and contact detail to first years, not, you know, all first years on the whole campus will be the foundation for all their second year, their third year, their senior years, so that they know, don't suffer in silence. There are places to go because they are there and students should access them.
Definitely.
Thank you so much. And then our last question that came through is, how do you know how much stress you should tolerate from schoolwork or where to draw the line? Because sometimes it feels as a first year health science student that I just need to tolerate the immense pressure and stress from school. I also find it difficult to know when to take a break without feeling anxious because I feel like I should be or could be doing some work.
So I think that it's a difficult question in the sense that everyone has their own capacity for what they are capable of. Everybody has their own limit for everything in life. You know, for example, it's a stupid example, but I'm not the world's most patient person. So it will take something very little to set me off. And with my husband, you can push him and push him and push him and push him, and he never loses his temper. So there is a great difference between all of us. And that is something you also have to start to figure out for yourself. I think it's important, like Luke mentioned earlier, that you engage with your friends, specifically the friends you have that are in health sciences, either in the years above you or in your year, or even those in the allied professions, because they also go through this as well. And it actually doesn't matter what faculty they're in. There is a great deal of comfort in knowing what everybody else is going through, but I also don't think you can hold yourself to your friend who appears like they've got this and they're not struggling. It looks like water off a duck's back. Meanwhile, you feel like you can barely stay afloat. So I do think you have to also try and figure out where your limit is. I do remember being very stressed. I do remember being very overwhelmed. But what sort of helped me was, like Luke mentioned, it was a group of 5 of us who we used to split the work. We'd make notes for the work, and then we would come together and it would be in my lounge of my parents' house or in the res of the people that everybody stayed in, and we would share our notes and we'd all just sit and chat about what we'd studied. And seeing where everybody else was in their stress levels and their degree of being overwhelmed helped me to draw my own boundaries. And for me to understand, okay, well, Sarah seems to be flying through this. I'm not that person, but I'm definitely less stressed than Quibus is. So, you know, for where I am, I think I'm in a good place. So I know we shouldn't compare ourselves to others and we shouldn't compete with others, but sometimes having that yardstick of being able to see, I seem to be sort of in the same vein as my friends. This seems okay, and it's what I can cope with. That's a boundary you are going to have to set for yourself.
Once again, I can only support that. We have different attributes, we have different characteristics, and we should know what our limits are and to which extent we can push them, and then seek that help with your circle of friends. And what I'm good at, someone else isn't. So we support one another with that. And my heart breaks to hear that there's already a question from a first year student saying, I feel I cannot cope. Please, know where you need to draw that line. Don't cross that line of not being able to cope, because it's going to have so many detrimental effects on everything else. Also, your possibility to study successfully. So rather draw back and say, I need to take a week off, a mental health week off. And then come back and catch up, and not catch up so that you on that point of burnout again. So it's really, see what your own limits are, and don't allow yourself to overstretch them.
And if I can add one more thing, I think something that I learned perhaps the hard way was the way I studied in school did not fit for medicine. I was fortunate that I had a very good memory, and I could read my notes on physics and the laws of momentum and Newton's 3 laws, and they were in there and they stayed there. And it's some stupid things I can still rattle off today, even though it's got nothing to do with my life. But I cannot study like that for medicine. And I haven't been able to study like that since I got into med school. I've done 2 postgrad degrees, and I haven't been able to study like that, even now as a grown-up. So something that is perhaps worthwhile is contacting a facility like OSS and chatting to someone like Dr. Coupe, who can give you other ways to study, because perhaps we are applying ourselves in a way that doesn't fit for medicine. And that is why we're burning out. And that is why we are feeling like we can't cope, because we're using strategies that helped us when we were in grade 11 and matric. But now we have to change our strategies completely, because we're learning volumes of work that can't be compared to schoolwork. We're learning content of words that I've never heard of in my life before. And the added pressure that one day I'm going to have to apply this on a real human being. And what if I make a mistake and I kill them? So I really do think being willing to admit that perhaps the way we're studying isn't as good as it should be for the profession we are currently in, and being willing to explore other avenues, having looks at YouTube channels, different videos, speaking to people like Dr. Coupe and accessing other ways that we could be studying that might reduce our cognitive load, but still give us the same outcome that we're looking for. So especially if it's first year, I'm just thinking of the huge jump I felt when I went from matric into first year, and how what I was doing then could not be translated into medicine in the slightest.
Thank you once again for answering our questions. It really makes me feel a lot better to know that someone who's been where I am right now knows what I'm going through, and it's really encouraging to know that I will make it, as hard as I have to work and as daunting as it seems. So I'd just like to hand over to Simran, who's going to introduce our quiz winner.
Thank you, Barry. One thing we should also remember before I announce the quiz is that mental health experiences are different for each and every individual. Like for me personally, it would be exhaustion and mental health completely being in sync. So we reached out to our followers last night and asked them what words best describe their mental health experiences. And this is what we received, as you can see. And all the words we received, and to reiterate what our speakers have said, this is a condition so many of us experience, and how hard we tend to push in terms of academics without looking after ourselves, and burning out is almost considered the new normal. and this definitely is not how it should be. Universities definitely need to enhance the policies regarding mental health and preserve student health. Yeah, okay. And there was also a quiz which took place on our Instagram page earlier today regarding mental health and some questions surrounding it. And I'm privileged to announce the winner, and also just like to apologize if I do pronounce your name incorrectly. But the winner for the quiz is, I'm just imagining there's a drum roll somewhere here. But non-Dumiso Mudanal War. So congratulations, Nandamiso, and we will stay in touch with you for the prize. Just one announcement from the Bioethics Society as well. We've created a new form of communication through a WhatsApp group where you can join and be a part of bioethical discussions, which will take place monthly for now. And you can also be the first to receive event announcements and reminders when you join the group. This is also another alternative way in which we're trying to create a safe space for each individual to reach out to us, especially when needed help. The link to join this WhatsApp group will be found on our social platforms, so just stay in contact for that. And yeah, that's everything from my side. Nikisa, can you take over from here? Thanks.
Hi, thank you, Simran. Hi, everyone. My name is Nikisa, and I'm part of the WITS Bioethics Society. On behalf of the Bioethics Society and the Surgical Society, we would like to thank our guest speaker, Dr. Rabbi, for such an informative talk and sharing the message on why it is important to care for ourselves before we are able to care for others. You have certainly emphasized why we should speak up and work to fix the system so that the stigma stops with us. Secondly, we would like to express our gratitude to Dr. Lautenberg for always being willing to engage in mental health discussions. Thank you for stressing the importance of these discussions and for creating the space for them. Thank you to the WITS Unit for Undergraduate Medical Education for their continued support. We would like to thank the Itemba Foundation for their initiative and continued efforts in raising awareness for mental health in South Africa. We would also like to acknowledge CIPLA South Africa and thank them for continuing to raising awareness for the mental health of our healthcare workers and for providing our society members with amazing socks. Thank you to Luke for discussing mental health in the LGBT community and for sharing resources in which people within our community can use to seek help. I would also like to thank both the Bioethics Society and the Surgical Society team for as an event like this cannot happen on its own. Thank you to both societies for all the hard work in making today happen. And lastly, we would like to thank our audience of students and professionals for taking out the time out of your schedule to attend today. Events like this would not be successful without you. Thank you for attending.